Hi, Dr. Caxton Opere. This is to my colleagues, my physicians, healthcare practitioners, and it's about this new book that I just wrote, Physician Treatment Strategies. You see, most of us are very busy between seeing patients, getting information that will help us. And if you've been to the CDC a couple of times, you'd find that might not be right now having enough information that will help you with your patients. And so I wrote this book, went through hundreds of journals, combed through. And in that amount of time, I realized that it's almost impossible to get all the information that you need if you're a practicing physician or healthcare practitioner, nurse practitioner, PA. And it's important, nevertheless, whether or not you're busy, to have that information available so that you can care for patients with COVID-19 infection or at risk of developing such an infection. You know, the time part is the most important thing for you in your practice. Where do you find the time to comb through hundreds of journals like I did? Where do you find the time to decide what journals are relevant? And if you're not careful in reading the wrong kind of journals, you might end up making the wrong conclusions. So here's what I've done. I've written a book, cited the most important authoritative references for the concept. The book, Physician Treatment Strategies, is really a book of tactics and strategies for the healthcare practitioner who wants to intelligently manage patients, either infected, tested, and proven to have COVID-19, and what they need to do in the clinic, ER, or hospital setting, and how to go about. So I'm going to tell you some of the features of this new book that I just wrote. This is the book. It's now on the Apple Store. Frankly, I think if you have an iPhone, it puts you in a different class all by yourself. Not that having an Android is not important or doesn't make you important, but it means you know the value of seamless integration of systems. You know, maybe you have a Mac, an iPhone, or you just like the way it performs. This is the book that functions in that manner. And I've put the book on iTunes for that same purpose. And I was excited that the book is on that platform right now. But here are the things. Number one, most of us practicing need information that we can use right there, right away. Okay? Getting that information, however, is hard because one of the places that we go to is the Center for Disease Control. And I dare you to try going there and see whether you'll get what you need. It's very, very unlikely that you get all this information that I've been able to put together. So what do we need to do? What do we need to look at? Your time. That's extremely valuable. You cannot afford to waste that time. Number two is safety. You'll understand that if you don't understand and have the information and knowledge that's in the book, it's going to be hard for you to decide some key management principles. And not knowing those management principles can actually compromise your patient and put you also at risk, as well as your family and your staff. That's not a good thing because we already know that COVID-19 is a very deadly illness. And so there are some things that I'm going to share with you in a few minutes, okay? The nature of your practice and the ability to practice with integrity in spite of the controversies is extremely important to you. I am assured that you share those same concepts with me, that I need information that I can use in addressing my patients that may or may not have COVID-19 and those suspiciously infected that we don't have the test results back yet. So what do I do? So there's some features. I'm going to give you a few of them. Number one is, how powerful is a COVID-19 sneeze? You're going to get that inside the book. It's going to share some things with you about someone who sneezes and has COVID-19. What's the impact of that to you as a clinician? Second, what's an R naught as far as COVID-19 or influenza is concerned? What are those numbers? How do you get all that information by not going to too many journals? Where can you just say in one spot, one shopping center, one simple place that you can get all that information? That's Physician Treatment Strategies, my book, my new book, That's where you'll get that information from. There's something called it's a new formula. It's called an alveolar correlation score. The alveolar correlation score tells you exactly where a patient who may be COVID-19 infected, who is otherwise young and healthy, without any lung or heart problems, exactly where they are in terms of pathophysiology, linking what's going on in the alveoli to something so simple as a test that is routinely done in the clinic, in the ER, or in the hospital. Those things you need to know. Then I'm sharing the 3 T's: how to triage, how to test, and how to treat that patient that you may suspect or who's already been positive for COVID-19 or is at high risk either of deteriorating, death, or getting infected. How do you triage them? You're going to learn that. Another thing you're going to get from this book is how to avoid the controversies that are in the media. And as you've seen, a whole professor of medicine had to withdraw his book. But in this situation, a professor had to retract 2 journal articles because they didn't make any statistical or clinical sense at the end of the day. But those were journal publications in the Lancet and the New England Journal. So you're going to learn how to eliminate the controversies as you develop your own strategic thinking thought processes, which is why we went to med school in the first place. We can handle diseases that we've never seen before because we have principles and we know pathology and pharmacology that can help us integrate what we know, what we've been trained to do, and who we are as doctors with all the experience that we have and the colleagues that surround us to create and formulate a treatment strategy for our own patients. You're going to get that. So what is antibody-dependent enhancement of viral infections? Every treating physician who deals with COVID-19 patients needs to know what ADE, what it means, and the implications in caring for patients. So when it comes to time, safety, and actually developing the confidence, don't mind the fact that there's so much out there. The media is not a bunch of doctors. It's you and I, the healthcare practitioners trained to know how to address the issues of our time, medically speaking. So you're going to get the most in the shortest amount of time in physician treatment strategies. So if you have an iPhone and you're a healthcare practitioner, if you get this book, you're going to save yourself time, money. You're going to increase your confidence level in dealing with the pandemic as a whole and your own patients in particular. And the safety measures that you need to put in place will be clearer to you when you get this book, Physician Treatment Strategies. It's not anywhere else. It's on iTunes. And I think there's some other platforms that have it. But I want you to get that book because it's going to help you to solve so many problems for so many people during this pandemic. This is Dr. Caxton Opere. Have a wonderful day. And remember, your time is extremely important. Jumping from journal to journal to journal to journal is not going to help. The safety measures that need to be in place, the confidence level that you need to beat, the time with which you spend going to get that information is going to be a deciding factor. And I trust that when you get this book, you'll appreciate why I've said so. Thank you for watching Dr. Caxton Opere.